everybody, welcome. It's Dr. Brown from K&S Chiropractic, your Baltimore area chiropractor. Today I'm going to show you how we treat somebody that has a lumbar disc herniation, which is causing pain down the leg. So let's get started. We're here today with Betty. I'm going to let Betty tell you what's going on with her. And we've been treating Betty for the last few weeks, so let's do it.
Okay, I was having problems with my lower back, my L4, L5 disc, and the pain got so excruciating I started physical therapy. I went to physical therapy for 6 weeks, and then I stopped, and then I went back for another 2 weeks, and then I found out they're not helping me, and if anything, they were making it worse. So then I was coming along down Ricestown Road.
Hold on, let me just interrupt you real quick. So you had your physical therapy.
Yes.
Then you went to pain management.
Yes.
Pain management.
I had injections.
Cortisone injections in the lower back.
Yes, and that didn't help me either.
Did they put you on medication?
Yes, they did. I got medication for the pain, and I really didn't want to take it because it's a narcotic. So I thought I'd find a chiropractor to come to, and I just kind of scanned my phone really to see which one, if one was in my area. So I found K&S, right? K&D?
K&S, KB, Kevin Brown, but K&S.
Yeah.
Love my partner.
And I came here, and within the first week, I noticed a big difference. I wasn't having the pain that was excruciating and debilitating to me that I couldn't even walk. So now the pain, after coming here for 3 weeks, the pain has subsided a lot. I'm getting a lot better. I'm able to go on my trips and sit for long periods of time. And I'm happy with the results I'm getting.
Yeah, I mean, we had about a 2-week period that Betty told me when she, first of all, Betty was extremely nervous about coming in here. Saw her at the front desk, asking the girl, should I do this? Should I not do this? She was very worried. Her husband was with her. And the girls are like, yeah, this should help you. It helps most people.
Yeah. And,
you know, I met her in the room the first day, and it's been a love affair ever since, right?
Absolutely.
Thank you. But what I wanted to tell you though, so she's got this pain that's been going down her leg, and the mornings have been the worst for her. She'd get out of bed after a couple minutes, she'd have this pain, and she could hardly walk and do the things that she wanted to do. So we had about a 2-week window because Betty informed me on her first visit, look, I really want to go on this trip. I want to go see my son, he's down in Atlanta, and I need to take this trip. It's really important to me. So we really had to do our best work to get her better as quick as possible, and thank God everything worked out good, and she was able to go away, and she just got back, and she did well not being here for like 5 or 6 days, right, about a week, so that's good, and she's back. Still has a little bit of pain when she gets out, just for about 10 minutes now, and then it dissipates, so that's wonderful. What we've been doing to Betty is this. I put her on electrical stim to help relax the muscles, get rid of some of the inflammation away from that low back. Down in that L5-S1 joint, she's got a disc herniation. I don't have my motto on here, but what's going on down here at this lower joint on her, the back is squashed. So these vertebrae are compressed down, the disc bulges out, puts pain down, puts pressure down the nerve that goes down her leg. That's why she's feeling crummy. So what we're doing, the electrical stim relaxes the muscles, gets rid of some of the swelling, and the most important thing we're doing to her is what's called a flexion distraction adjustment. And what that does is that takes this jammed up joint and pulls it apart and opens up that disc space. She feels bad because it's being jammed. This pulls it apart and opens it up. And by doing this repetitively over a few weeks, couple months, probably worth of treatment, this will help to keep this open. We'll do things to stretch and strengthen that joint out, so then she doesn't need to be in here for the rest of her life. So I'm going to show you how we do this. Okay, lay on your stomach. She was already on electrical stimulation, so I'm going to show you how we stretch her out. Okay. All right? Okay. All right, scoot on up a teeny bit. Good, perfect, right there. So what I'm going to do is I'm going to strap her legs in here. She's going to hold on up here, both hands. And what this table is going to do is the table is going to separate here, which is going to pull apart that low back, open up these joints that are being jammed together. This is what's happening. We want to open them up and then flex that table down to take all the pressure off of the back of that disc and the back of that nerve. Watch, you'll see what happens as I pull this table apart. And she's gonna hold on. Feels good, right, Betty?
Yes.
This feels very, very, very relieving to somebody that has a disc problem, because this opens it up. So her problem is down at this L4, L5 joint, which is right here. So this is the one we're gonna wanna separate. And what we're gonna do is I'm gonna support that vertebra, that L4 vertebra, and flex this table down. And even though it's a very subtle movement, you can see this table going, it's really opening up that joint very deeply. It feels good, right?
Yes.
So what's it feel like?
Feels like it's stretching.
Pressure's being released?
Pressure, yes.
Right.
Absolutely.
So this is stretching that out. So what we're trying to do is just open up this joint. Just try to separate this. And by doing this, we'll stretch this out, we'll separate this joint, and then hopefully over the next week or so, we'll do some things to Betty which will help to strengthen it, so then her body will remember to keep this joint open and keep it in this position. Now, she has homework to do too, because we gave her stretches to do, which you can find on my YouTube channel. There are 4 good stretches for the low back. So she does those a couple times a day, which helps to keep the pressure off of there when she's not here. She knows if she gets sore to put some ice on it.
Yes.
We'll do things to strengthen it. And what she'll have to do even after she stops treatment here, will be to continue to stretch it out so the pressure stays off of there. It feels really good, right?
Yes, it does.
Okay. So it looks like a very, very, very simple treatment, which it is, but it's extremely effective. Somebody that has a disc problem, this is the best thing to do. Somebody that has pain down the back of the leg, this is what you do. This opens up the joint. See, she had her injections. Injections reduce the swelling away from that area. But if the vertebra is compressed, if the joints compress together, you can take as much medicine as you want. There is no way that the medicine is going to pull this apart. The only way to pull this apart is by doing what we're doing.
Yeah.
So, most of the time, the doctors that we deal with, somebody will get injections, but while they're getting the injections, we'll also do this treatment. So then you're getting the best of both worlds. You're reducing the inflammation by getting the injection, and then you get to stretch the joint out, which then really solves this problem. And then with the exercise she's doing, that'll keep that feeling good. So
Yeah.
a couple more pumps here. And I'm starting to feel the vertebra open up. When she came in for the first couple weeks, even though she was getting relief, we weren't getting good separation of those vertebrae. But I'm starting to feel that, and I told her that the other day, I'm starting to feel the vertebra move underneath my hand, which is good because I know that it's separating. And the main thing is, she's feeling good, so we know we're on the right track here. Good, simple. We'll push the table together. Sit you up.
Okay.
Let's see if she can do this. Anybody can get down, that's the easy part.
Let's swing around here.
That was good.
Yes. Should I stand?
Sure. Stand, give me a hug.
We'll stand and start our minuet.
I'm glad she's doing good. It makes me feel good when my patients do better.
Yes.
All right, everybody.
I'm so happy with this treatment because I was ready to shoot myself.
And the girls here are good, everybody that...
Oh, the girls are beautiful. I've adopted every one of them.
You know what? I'm going to tell you how much she liked it. She was so nervous of coming in. The second day after her treatment, she went and you got them some cookies, they told me, and... Right? Wasn't that you?
Mm-hmm.
Yeah.
Sweets for the sweet.
All right, everybody. Look, thanks for joining. I appreciate it. Subscribe to my YouTube channel. Leave a comment, question about this treatment or whatever type of treatment you're getting done to you. And we will see you next week for another video. Thanks for watching.